Hey folks, this is Dr. Desai. I'm here at headquarters. I'm just going to do a quick video here to go over our ventilator and all the pieces that complement of it. I'm going to go over a quick refresher or instructional for those that don't know on our ventilator, all the pieces to it, and how you can go about using all this. It's a very simple vent to use, but I know we got a lot of folks that are new, may have never used it. So I'm going to do a quick refresher here. So what we have, this is our ventilator here. It's the AutoVent 2000. It's got two functions. You can set the tidal volume on it, and you can set the respiratory rate on it. You have your green hose that hooks up to the oxygen tank, and you got your white hoses that hook up to the piece that you're going to hook up to the patient, to the ET tube. I'm going to turn the oxygen on here. So I'm just for reference here, I'm gonna put a rate of 15. These white notches show you exactly what you got it on. I know there's not a great notch here for the tidal volume, but you get the point here. So when you turn this on, you want to make sure your vents, your piece is working properly. This little piece, whenever it's blowing a breath, you should see this little glass capsule fill up with the little green rubber. Air blows out of here. And the other thing you should test, this ventilator actually has a pressure alarm. So if you get a high pressure, it's got a little teapot whistle that blows, letting you know that the pressure is too high and maybe you need to unhook the vent, maybe you need to suction the patient, maybe the patient's biting on the tube. Whatever, you need to check and see why the pressure is so high. Don't keep inflating, or are you giving them too much tidal volume and you've overinflated them? So keep that in mind. I'm going to show you how it hooks up. It's pretty easy, pretty straightforward. You have your tubing here that hooks up to the tube. Do not throw this away. This is not disposable. And then you have the patient piece that hooks up to the tube. This is also not disposable. You do not throw this away. Okay, you have the gasket piece. It hooks up to the tubing, and you can feel the air. It blows out from here, and this is the port for exhalation. When you have folks that have a terrible pneumonia, or they're coughing up a lot of mucus, or they're coughing up blood, you want to use your ViroGuard. This is basically, it's just a little filter that hooks on and prevents reflux of bacteria, viruses, infectious processes from entering to your ventilator and passing it on to your next patient. So remember to use this, okay? So the next thing I'm going to show you, this is, you hook up your ViroGuard, and then you hook up your disposable tubing, and then you hook this piece up to your endotracheal tube, okay? This is disposable, okay? You can throw that away. This is also disposable. You can throw this away. The other thing that I want to show you that a lot of you may not know about is that we also have a PEEP valve, okay? So we can actually do more than just tidal volume and respiratory rate. We do have a PEEP valve as well that you can attach, and it goes from a Peep of 5 all the way up to 20. So if you ever have a patient that's requiring some PEEP, you're not able to get them oxygenated because they have a bad pneumonia or atelectasis or whatever, you can attach the PEEP valve, you attach it to the exhalation port, and it's basically, you just turn it. I don't know if you guys can see the numbers on there, but as you unscrew it, you can see, you can set it to a Peep of 5, and then as you screw it down, you can increase the amount of PEEP that you're giving the patient, okay? So I'm going to just demonstrate for those of you guys what PEEP exactly is and how a ventilator works, okay? So we're going to pretend this bag from a non-rebreather, that's your lung, and when we hook up, this is just a regular vent without any PEEP. When we hook it up, and I've got the tidal volume really high, folks, so, but this is just to let you know what happens. So watch what happens to the lungs, okay? You put them on the vent, So if you've got your tidal volume too high, you see how that alarm goes off? And that bag looks like it's gonna burst. That's basically what you do to your lungs when you have too much tidal volume. Okay? So that's why it's important to get the right tidal volume. And you can see how, you know, in your sick patients, if you have too much tidal volume, you're inflating them. So you want to get the tidal volume right. Okay? Now let me show you the difference. What happens when we have a PEEP valve on here. So PEEP is short for positive inexpiratory pressure. Okay, and I'm gonna max this out at a 20 of PEEP just to kind of get the picture across here. And let's crumple our lungs up here. Okay, you got a patient with terrible atelectasis here. Okay, this is what atelectasis is. But watch what happens here, and pay attention to what the pressure alarm does when you have PEEP on there. Okay. Now watch. So you can hear that pressure alarm. It's a lot louder, it's a lot higher pitched, and it's ringing for a lot louder too, right? And that's basically what PEEP does. Look at the bag. You see how little it deflates with every breath? So that PEEP, it's basically pressure that remains in the lung at the end of the expiration. And so when you got a patient with bad atelectasis, or they've got a terrible pneumonia, you can't get their lungs expanded, or you know you're having trouble oxygenating them because of these problems, you add a little PEEP on there, and now their lung stays open at the end of each breath, and they're able to exchange oxygen a whole lot better. And the reason this works is it's a very simple mechanic here. This is where if a patient's breathing spontaneously, the exhalation comes out of this port. This little valve is basically just blocking some of the air off, and you know you're basically controlling how much you're allowing the exhalation air to leave and how much is staying put in the lung and keeping the lung expanded. So that's basically how that works. I hope that clears up any confusion if anybody's had it. Again, I'll show you without the PEEP valve. I'll give you a side view so you can see how much it deflates. It doesn't deflate a lot. Of course, we're not using a lung here. We're using a small bag, and I've got the tidal volume much higher. Now, again, watch what happens with the PEEP valve. And for theatrics, I've got the PEEP all the way up on 20. You see how little the bag deflates now? Okay, well, I think you guys get the picture. And I think the guys here at Make Ready are getting annoyed with that alarm. So I'm going to turn this all off, and I hope that that helped refresh some folks' use of the ventilator. Or if not, I hope it educated you on what we can do with our vents. Any questions, of course, email me. You can leave comments in the section below, and I'll answer them, or just email me, and we'll see you next time.